Hi, I'm Erica Kennett, a registered sleep technologist at Ohio Health Sleep Services. A sleep study, or polysomnogram, is a medical test where various biological signals are recorded in order to detect a wide variety of sleep disorders. Some of the most common sleep disorders are obstructive sleep apnea, or the repeated cessation of breathing while asleep, and limb movement disorders, such as restless leg syndrome. Since obstructive sleep apnea is the most common sleep disorder found during a sleep study, we also record bodily signals that indicate the presence of breathing abnormalities during sleep. With two sensors that sit under the nose, sleep techs record when someone is breathing and if their airflow ever decreases or stops altogether. Since snoring is one of the most common signs of sleep apnea, it's recorded with a microphone that gets taped onto the neck. Two belts around the chest and abdomen record breathing effort. While sleep apnea is the cessation of breathing during sleep, there are different types of apnea that are differentiated by whether someone is making an effort to breathe or just holding their breath. Since these types have different causes and often require different treatments, it's important to record breathing effort as well as actual airflow. Blood oxygen levels are measured with a pulse oximeter on the finger. This is particularly important to record as a lack of oxygen during sleep is often responsible for the heart conditions that sleep apnea can lead to. Here's how these readings look on a sleep study. At the top is the snore channel, which is flat because this person wasn't snoring. The first blue channel shows airflow, with each wave corresponding to one full breath. Below, the breathing effort signals recorded with the chest and abdominal belts are displayed the same way. At the bottom is a constant readout of blood oxygen levels from the pulse oximeter. The top image here is from the sleep study of someone who has severe obstructive sleep apnea. You can see that the airflow channels go flat, indicating that this person stopped breathing, and then blood oxygen levels drop as a result. With severe apnea, this pattern happens over and over all night long. This particular individual had such severe apnea that continuous positive airway pressure, or CPAP therapy, was started that same night in the sleep lab. The bottom image shows how CPAP normalized breathing patterns and oxygen levels. This study also shows severe sleep apnea, not because this person completely stopped breathing, but because their oxygen levels dropped very low during REM sleep. Sleep specialists consider a number of factors when making a diagnosis of sleep apnea, including both how low oxygen levels drop and how many times per hour someone stops breathing.